Awesome. Okay. Thank you everyone for having me today. It's my absolute pleasure to talk about the physiotherapy management of POTS with all of you. Before we go ahead, I'd like to talk a little bit about me. I am Trineta and I am a registered physiotherapist in British Columbia. It's my absolute passion to help those living with chronic conditions thrive, which is why I lead rehabilitation programs for dysautonomia, concussion, vestibular rehabilitation, and functional neurological disorders. I am also a clinical supervisor for UBCPT students, and I presently work at CPRI as well as Catch Physio and Wellness, both in Vancouver and New Westminster. Now, before I get into the rehab management of POTS, I'd like to talk a little bit about what dysautonomia is, as well as about POTS. So we have an autonomic nervous system in our body, and this is a part of the nervous system that controls all the automatic functions of our body. So blood pressure, heart rate, temperature regulation, digestion, and many more functions which are not in our control are taken over by the autonomic nervous system. And this nervous system has two divisions to it. One is the fight or flight state, also called as the sympathetic state, and the other is the parasympathetic state, which we also commonly call as a rest and digest state. Now, dysautonomia is an umbrella term for all conditions in which there is a dysfunction in the autonomic nervous system. So essentially, there is an imbalance between this sympathetic and parasympathetic state, and individuals with these conditions tend to be having a heightened fight or flight state or heightened sympathetic state. So this is sort of the baseline that we see in most patients with dysautonomia. And POTS is a type of dysautonomia, which is also called postural orthostatic tachycardia syndrome. And as the name suggests, it is postural, so posture-related tachycardia, which is increase in heart rate. So when individuals with POTS go from a lying position to a standing position, or from a sitting position to a standing position, there is a significant increase in heart rate, which is considered abnormal. Now, why this happens is that gravity usually forces blood into the lower body and abdomen. And we have a lot of mechanisms in our body that help counteract that effect and help the blood go back into our heart and then our brain. However, in individuals with POTS, a lot of these normal mechanisms are altered, and this causes a reduced perfusion of the brain. This causes a lot of symptoms like lightheadedness, brain fog, fatigue, nausea, and many more. Now, I won't go much into the diagnostic criteria or mechanisms because that is not in my scope. But what I usually do is I screen patients for POTS. So if an individual comes to me and has a history that is suggestive of POTS, I will do a NASA lean test or an active stand test in clinic and then send those results to their medical provider for further evaluation. Now, once they're diagnosed with POTS, rehab can play a huge role in their care. The reason being that all of those symptoms that we saw before can affect an individual's functionality. And rehab can play a huge role in helping them regain that functionality. We don't have a cure for POTS. Rehab does not cure anything. However, it can help you live better with the condition. I obviously cannot go over everything I do for my POTS patients today, but my goal today is that I highlight some of the important areas that I pay attention to with the hope that you can dive into that further. All right, so let's start with fluid and salt, which is a really important part of POTS management. The reason being that both fluid and salt can help increase the blood volume, which can then increase the circulation. Now, some generic recommendations for fluid and salt are about 2 or 3 liters of water a day and about 8 to 12 grams of salt, which is also 3,000 to 4,600 mg of sodium, which equates to about 2 teaspoons of salt. Having said that, I don't make these recommendations. These recommendations have to come from your medical provider. because your medical history, as well as the type of POTS that an individual may experience, is important to consider. However, what I do help is that once we have those recommendations, I help my patients be able to reach their targets as well as be able to track them, because this can influence the impact of rehab. So some cool ways of doing that are getting these labeled water bottles. They're really pretty to look at. They have labeled markers and can be helpful to track the water intake. Some patients also like to supplement their fluid and electrolyte requirements with electrolytes. Elementi, Nun, Liquid IV are some great brands that we have. For those who may not know, Nun actually offers a 30% discount for individuals diagnosed with POTS. So if you email them, then you could avail that. Some patients also like to take salt tablets like Vitatium. Vitatium is one of the most popular brands for this. And if you want to make your own recipe, then WHO has a home ORS recipe that you can also look at. Sometimes I also tell my patients that put the required teaspoons of salt in a Ziploc bag and then make sure that by the end of the day, you have utilized that in your food. Another thing to consider is that if you're looking at food labels, you should be looking at the sodium content. That will help guide if you've reached the maximum sodium intake that you need. Compression garments are also very essential in POTS management. They can really help people maintain that circulation of blood because they passively provide a pressure that keeps the blood moving and helps it go back into the heart. It prevents leg pulling through the passive compression that it offers. More often than not, I see individuals wear knee-high or thigh-high compression garments, which are good, but literature now suggests that waist-high compression garments with an abdominal binder is the most effective compression. Literature also suggests that abdominal compression alone is better than knee or thigh-high stockings. So this is something to keep in mind because this is where I start. Abdominal compression can be really, really valuable given the amount of circulation that is there in that area. Now, 20 to 30 mmHg medical grade compression or higher is usually recommended. 30 to 40 is obviously very good and has great effects, but most patients cannot tolerate that on a day-to-day basis. Now, compression is a discussion to have with your provider because gastric issues, sensory sensitivities can make, can have an impact on that decision. But these are just some general recommendations. Sorry, I skipped that one. Now, most of my POTS patients often come back and tell me that compression is great, but it is so tiring to wear them. And I did actually once try to wear them myself, and it was really, really fatiguing. So I did some problem solving and found some great donning and doffing devices. This is a donning device that can really help you pull up the socks well. There are doffing devices that can help you slip the compression garment out. Segaverus is a really popular brand for compression garments, and they have their own donning and doffing equipment. I also often tell my patients that wearing rubber gloves can be helpful because they help you get a better grip on the garments. And using a pedicure stool, like you can see in the picture, can be helpful to place your foot on and prevent some of that excessive bending. Now, a cheap dupe for home is the plastic bag method for donning the compression garments. I've linked a video of that in case you'd like to check it out. So again, this is some problem solving, some trial and error that goes into figuring out what really works for you. Mornings are usually very challenging for individuals living with POTS. It's usually when the symptoms are actually the worst. So some things that can help is elevating the bed. Now, the idea is to elevate your bed by 4 to 6 inches, such that your head is higher than the heart is higher than the kidneys, and the kidneys are higher than the legs. So the full body elevation is really important. A lot of times I see people only elevating their upper body, but that is not known to be that helpful. The idea of doing this is to prevent the excessive fluid loss at night, which can make the mornings more tolerable. So putting bricks at the head of your bed can be one way of doing this. And even a full body wedge can sometimes be a good way of incorporating this. We don't have a lot of literature for this. It doesn't work for everyone, but my usual suggestion is to at least try it for a month before giving up. Now, as I said, mornings are very challenging for individuals with POTS. So having a step-by-step routine can help make them more tolerable. Some general guidelines I tell my patients is that start your morning with at least half a liter of water on waking up. And then some gentle movements in bed can be incorporated, like moving the ankle up and down, bending your knees and straightening them, squeezing the glutes. I often also tell my patients to sleep such that their legs are facing the wall. That way, when they're waking up in the morning, they can prop their legs on the wall and do some gentle stretches like that. So that can also enhance circulation. And belly breathing in bed is a good adjunct for calming the nervous system in those challenging morning periods. Now, it's really important to progress from the lying position to standing position very slowly. It has to be done in very small increments, especially in the morning. I usually tell my patients that take more than 10 minutes to go through that transition in the morning. Now, some of the morning activities can be more tolerable if done in a seated position, like brushing your teeth, preparing your breakfast. And bathing and showering are usually triggering activities for individuals with POTS. So it might be helpful to do them at night instead of leaving them for the mornings, which are already challenging. So hopefully those are some suggestions that may help you. I'll talk a little bit about exercise now, which is an extremely important part of managing POTS. But before I talk about exercise, I do want to say something important. When patients with POTS come to me at initial intake, I always screen for post-exertional malaise or chronic fatigue syndrome. I usually use the DePaul symptom questionnaire to do that, because graded exercise therapy is contraindicated for individuals living with these symptoms. It's really important to screen for this because I often have patients come to me who don't even have a diagnosis of CFS sometimes. So through a lot of questioning interviews, we try to figure out what their response to physical activity is. So anything I say about exercise right now is actually not applicable to this subset, and I will address this later on in my slides, okay? So motion is lotion for individuals with POTS. The reason being that when you exercise, the muscle tone increases, and that increased tone can increase the blood circulation. Exercise long-term has also been known to activate that parasympathetic system, which is the rest and digest state we spoke about. So it's a very useful tool in managing POTS. However, patients often have very negative experiences with exercise, the reason being they've attempted aggressive protocols. Exercise is very unique to every individual. I usually tell people to think about this happy turtle when they think about exercise. Slow and steady wins the race. Slow and low is really the approach to take with POTS, because exercise is a long-term game here. Now, the Levine and modified CHOP protocol is very popular amongst POTS patients. It's a well-researched protocol, although valuable, because it emphasizes the need to go from recumbent first and then upright when it comes to exercise. I do find that it can be aggressive for a lot of patients. So even if you're doing this protocol, you really should be listening to your body and taking it slow, because for many individuals, at least that I have worked with, they've had negative experiences with it. So I can't give a generic recommendation for exercise, but some things that I keep in mind are that I usually start my patients with gentle bed exercises. And this is because often even the diagnosis of POTS, especially in BC, takes over a year. And in that period, with the reduced movement, there's a lot of deconditioning. So when we're incorporating movement, I start with very gentle bed exercises for 3 to 4 weeks. And then when they're ready, I add some recumbent cardio. This can be using a recumbent bike or a recumbent rower. If access to those equipments is not possible, I even sometimes set an air cycling program while they're lying down, and we do it in an interval training format, or just some stepping while lying down or in sitting, again in an interval training format. So getting creative with exercise can be helpful. And then I build up to about 3 days a week of cardio and 3 days a week of leg and core exercises. Intensity and duration is very specific to that individual, but I feel that even starting with 5 minutes is a good start. Eventually, if they're able to tolerate cardio every day, then we incorporate that and very slowly move into upright positions. This could take anywhere between 3 to 6 months or even more. Now, some other things that can be helpful to make exercise tolerable is that often when POTS patients are told to do core exercises, they start with crunches or planks. Those are very challenging exercises and not often recommended to start with, especially crunches, because there's a lot of up and down movement in that. There are different ways to challenge the core: pelvic tilts, tabletop. More gentle ways to start core activation is where I recommend my patients to begin. And then getting creative with equipments can be helpful. So using therapy balls, using TheraBands, using rollers, all of that can add a challenge in the recumbent position. Pilates is a great way to incorporate exercise with POTS because it is a recumbent mat-based format. And especially the breath work in Pilates can make exercise quite tolerable. So incorporating breath work will be really helpful. We know that heat is a trigger for individuals with POTS. With exercise, the body naturally gets quite heated up. That is why exercising in a well-ventilated room with cooling towels or cooling fans can again make exercise tolerable. I usually tell my patients to wear compression garments during exercise and also monitor fluid and sodium both before and during exercise. Sleep is important for making exercise tolerable. And if you've had a bad night of sleep or you're having a challenging day, then having something called as a hard day routine can be really valuable. So it's really listening to your body and seeing how it feels on that particular day. Lastly, I think adding the element of joy in exercise is so important. I once had a patient who told me that her biggest loss with this condition was not being able to dance because she couldn't tolerate upright position. And we actually added some dance flow movements in the recumbent and seated position, which made exercise really joyful for her. So don't forget that element in your workouts because exercise is a long-term game. Now, to measure the intensity of exercise, I usually use the rate of perceived exertion scale. I don't usually use heart rate because most of my patients are on beta blockers, where heart rate is not a reliable indicator. And also, I like the idea of RPE because it incorporates listening to your body, which is important to me. And what I usually do is I start patients on a warm-up in the 4 to 6 range. Now, the reason I like this scale in particular is because it also involves a talk test element. So this makes it easy for people to carry forward that exercise on their own at home. So the 4 to 6 level is usually when the breathing gets a little heavy, they're able to hold a short conversation, and that's sort of the warm-up stage. And then we go towards 7 or 8 in the highest intensity phase of the exercise, in which they're borderline uncomfortable, short of breath, and they can speak a sentence. I usually don't go in the 9 or 10 range where individuals are barely able to speak a few words or very breathless, unable to talk. I don't go in those zones, at least in the workouts I plan. And then in the recovery state, we come down to 2 or 3 before we end the workout. So it's between this 2 to 3 to 7 to 8 range that I try to stay in the workouts. Now, some fatigue during and after exercise is expected. The initial few weeks with exercise are challenging, but my general rule of thumb is that 90 minutes post-exercise, the symptoms should start to feel a little better. And as I said, we avoid going in the 9 or 10 zone with exercises. Now, the Dysautonomia International website has some great resources for exercise. They have videos for reclined exercises, videos for chair exercises, and also pool exercises. I think pool exercises are very valuable for those with POTS because water provides a natural compression to the body that can aid with circulation. So I've often seen the upright tolerance to actually be fairly good in the pool. And the website also has the CHOP protocol, if you'd like to have a look at that. If you are following this protocol, I strongly recommend to listen to your body and to take it at your own pace. All right, we're now going to talk about the nervous system regulation. Now, as we saw earlier, in individuals with POTS, there is a tendency to be in the heightened fight or flight state, which is the sympathetic overdrive. So incorporating strategies that can calm the nervous system through the day can be very helpful to counteract that state of the nervous system. And there are some easy ways of doing that in your daily life. One is through breath work. What I often teach my patients is something called 4-7 belly breathing. Now, this technique is usually I have them keep their hands on their belly, take a slow, relaxed inhale for 4 counts, hold that for 2 counts, and then exhale for 7 counts as if they're blowing a candle. So the reason I tell patients to hold for 2 counts is that I've often seen holding for longer periods can lead to some dizziness. So I found 4 to 7 belly breathing to be an easy thing to incorporate day to day. Then other ways of doing this is just rubbing your hands on your thighs while performing long exhales. You can even try drawing alphabets on the thighs while performing long exhales. So sometimes I tell my patients, think of it as it's going to be your birthday every day going forward, and long exhales is something to incorporate on a day-to-day basis. Then some of my patients also enjoy blowing bubbles as an activity to incorporate long exhales. And another activity I like is the butterfly hug technique, which I personally use a lot. This involves making a little butterfly, keeping it on your chest, and then doing some alternate tapping while performing long exhales. So it feels like a little comfortable hug when your nervous system is feeling overwhelmed. Now, another way of grounding the system is through using the senses. So 5, 4, 3, 2, 1 is a really good technique which brings awareness of the surrounding. It basically incorporates paying attention to 5 things that you can see, 4 things that you can touch, 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste. Even using scents like peppermint and lavender can sometimes be calming for the nervous system. Weighted blankets, textured toys, and cooling packs on the neck and chest are some other methods. Now, some of my patients also like calming music as a way to help in grounding. And Lo-Fi Girl is a really popular playlist on Spotify these days for this. Practicing self-affirmations through the day can also be helpful. One that I personally love is this is safe, or this will pass, or I am safe and this will pass. Things like that keep me grounded through the day. Another technique is the progressive muscle relaxation. This is a technique which involves contracting and relaxing different muscles and joints of our body from down to top. I have attached a link of this in the next slide in case you'd like to check it out. Guided meditations are, of course, a great way to help with mindfulness and nervous system regulation. And one important thing I tell all my patients is that do activities that are meaningful to you, because adding joy and safety in the nervous system starts with doing things that are meaningful for us. So this could be coloring, painting, spending time in nature, cuddling your dog, anything that is meaningful for you. Now, vagal nerve stimulation has been very popular these days for helping with nervous system regulation. I have personally not tried this as much yet. I do plan to incorporate this in my practice this year, but I just wanted to put it out there in case you'd like to explore that further. So this is the grounding technique, the 5-4-3-2-1. Insight Timer and Calm are some apps that I like for guided meditation. And I've linked my favorite progressive muscle relaxation as well as the butterfly hug technique. All right, we'll now come to counter pressure maneuvers. Counter pressure maneuvers are simple movements that you can do through the day that can help increase the circulation and build tolerance for prolonged standing. So this is something like just crossing one leg in front of the other and squeezing the thighs, keeping one leg on a stool so that the weight bearing activates the muscles of the leg on the ground. Even just squatting down like this individual in the picture, leg kicks in sitting, calf raises, a pedaling motion when you're standing, and sometimes just even keeping your hands at a chest level can help with facilitating circulation. I once had a patient tell me that standing in church was really hard for her, and that was something very important for her quality of life. So performing these simple counter pressure maneuvers was something she found really helpful in tolerating that. All right, we've spoken a lot so far, so it's time for a little movement break. If you like, you can join me in performing some of those counter pressure maneuvers, moving your ankle up and down. You can also do some leg kicks. Let's take a little movement break. That's a lot of information overload. All right, let's go ahead. Now, because the nervous system is in a huge fight or flight state, often individuals with POTS have a lot of sensory sensitivities. So light, noise, motion sensitivity is very frequently seen. And there are some adaptive equipments that can help with that. So sunglasses and tinted glasses like the TheraSpecs can be really helpful for light sensitivity. Loop is a really good brand for earplugs. They have different grades for noise cancellation. So you could check out something in case you like any of those. But what I usually tell my patients is that over-reliance on these can actually further increase the sensitivity long run. So the idea is often to use just enough to maintain functionality, or use them only in community environments where the stimulation of these senses can sometimes be too much. I also often have patients tell me that they get very dizzy with head movements, or they get very dizzy in a grocery store. Now, the reason that happens is that we have three systems in our body: the vision, the vestibular, and the proprioceptive system. And these three systems together give information to our brain about where we are in space and our spatial orientation. Now, often in individuals with dysautonomia or that heightened fight or flight state, these three systems are not talking as well to each other. They're not integrating well. They're not communicating efficiently with the brain. And the lack of that can cause enhanced motion sensitivity. So this is when head movements, going in visually busy environments can be very triggering for people. Now, incorporating some elements of vestibular rehab in your care can be useful for this. It's outside the scope of the lecture today to dive into details of that, but working with a vestibular physio can be very helpful. I do incorporate some simple strategies and exercises into rehab care for POTS patients for this as well. Now, fatigue is one of the most challenging symptoms with POTS. It can be really impacting quality of life, and finding ways to conserve energy or manage fatigue can be extremely helpful. I'm sure most of you at some point have heard about the 4 Ps of managing fatigue, which is planning, pacing, prioritizing, and positioning. Now, planning essentially involves planning your week, distributing challenging activities through the week, and not having everything in one day, breaking down activities through the day to allow rest breaks. Pacing is again a really helpful tool, taking frequent breaks through the day, performing some of those grounding strategies that we discussed can be a useful adjunct to conserve your energy levels. And prioritizing, think about what really needs to be done in the day, what can be left for later, can help conserve energy. And positioning is a really important one for those with POTS. So lying down, when needed, sitting with legs propped up, sitting on a high bar stool instead of standing for different activities. Those are some ways which can help conserve energy. Something I also discuss with my clients often is to scale their symptoms from 0 to 10. And especially when they're going to engage in an activity that they know is challenging, monitor their symptoms frequently through it. So when the symptoms go up 2 points, take a break and perform some grounding strategies. That way we break a triggering activity and make it more tolerable. Now, the spoon theory is really popular among POTS patients. This was a theory that was devised by someone living with a chronic condition. And the idea behind this is that you wake up and you estimate how many spoons you have. Spoons represent the energy you have when you wake up. And then as you go through your day, you decide how many spoons you want to give to every activity. So if an activity like eating a meal is 1 spoon, and an activity like driving maybe 3 spoons because it conserves more energy. So depending on how much energy that activity takes out, you allocate spoons to every activity. The goal is to preserve your spoons through the day and not use them up before you finish the tasks that you need to finish for the day. If you want to read more about this, I have linked the Dysautonomia website, which has described this in quite a lot of detail. Now, poor sleep can often impact an individual's quality of life. And again, being more in that fight or flight state can be detrimental for sleep. And some simple sleep hygiene things that I go over are maintaining a consistent routine of bedtime, so waking up and sleeping at the same time, getting some sunlight exposure in the day. This could be just in the form of keeping the blinds open in the day, dimming lights and reducing exposure to technology 1 to 2 hours before sleeping, no large meals right before bed, and keeping the bed only for bedroom activities, no homework, no calls, none of all of that on the bed. So your body knows that when you're on the bed, you need to sleep. Bedtime stories, calming music, and guided meditations before sleeping can be helpful to fall asleep. And maintaining a cool, dark environment is also often helpful. Now, if sleep continues to be a challenge, I do discuss seeking support from a naturopath or a nutritionist who may advise some supplements that are helpful. Now, a common complaint that patients with POTS have is brain fog, and brain fog can really impact cognition. The reason, again, is that reduced perfusion of the brain in upright position. And addressing this is really important because a lot of times, you're navigating academics, you're navigating work while living with this condition. So some strategies that I've found helpful for cognition are positioning. So while engaging in a cognitively demanding task, sitting with legs propped up can be helpful. Some of my patients also like to lie down on their belly while performing some tasks on the laptop, or just play around with the position and see what works for you. And I usually also tell my patients that every 20 minutes, keep a timer to perform a counter pressure maneuver. So counter pressure maneuvers are the ones we discussed before. Performing them every 20 minutes while engaging in such tasks can be helpful to maintain circulation. In general, avoiding triggers like heat, overexertion, or lack of sleep can improve cognition. And even the 20-20-20 rule with screens is a good one. So every 20 minutes, looking away from the screen at a distance 20 feet away and giving your eyes a break from screen time can be helpful. Taking breaks during a cognitive task is useful, and just limiting the distractions in the environment can also be helpful for our nervous system. Sometimes I do also incorporate cognitive games and exercise in the rehab program. Now, there are a lot of assistive devices that can help individuals living with POTS. It's good to use them because the idea is to work smart and not hard. As we know, heat is a huge trigger for POTS symptoms. There are many cooling devices that you could use to maintain your body temperature. Cooling towels are a really good one, easy to carry, easy to use. Some of my POTS patients also like these cooling ice scarves because they look really pretty and can be worn in the community environment. For really bad days like the heat waves we often see in BC, cooling vests are really helpful. And then I often tell my patients to always carry a cooling fan with them. This could be a small cooling portable fan like this, or even a fan that you can wear around your neck. These are all easily available on Amazon. Some other accommodations we discuss are a shower chair or a tub bench. Bathing and showering can be very triggering with POTS, for POTS patients because it's usually not a well-ventilated space and it involves standing for a long time. So I think a shower chair and tub bench is very important even from a safety perspective. Then using robotic vacuums or other automatic cleaning devices can help conserve energy as well as prevent the frequent bending that those activities require. Sitting on a large heighted stool can be helpful instead of standing for all activities. And using long held devices, as you can see in the picture, can be helpful to prevent frequent bending. Now, something really nice I learned about at the Dysautonomia conference this year was this website called Jan. Now, Jan actually has a really good search engine where if you're struggling with an activity at work, you can type in that activity and then it gives you a lot of accommodations that you can discuss with your employer. So I've used this for some of my POTS patients who are working, and some of the suggestions were very helpful. So this might be something to look into if return to work is a goal. Having said that, when it comes to fatigue management, sleep, cognition, or assistive devices, working with an occupational therapist can be extremely helpful. They have a very detailed insight to these aspects. Often my patients don't have access to that service, and if they're working with me, then that is when I go into some basic things that we discussed. Now we live in a tech-savvy world. We have a lot of technology that can be useful. Some of the things that I use are biofeedback. I use biofeedback a lot for measuring heart rate variability. Now, heart rate variability is a way to gauge the state of your nervous system. So a low HRV indicates a higher sympathetic or fight or flight state, and a higher HRV indicates a parasympathetic or rest and digest state. And there are many devices that actually give the HRV real time. So I often incorporate these devices with a mindfulness or breath work activity that I teach my clients. For example, the belly breathing that we discuss, I often have my patients practice that while looking at their HRV. And often we see the HRV go higher or go up as they're practicing those activities. So really useful tool to sort of see the physiological change objectively. Another app that is really helpful is Tachycardia. This was invented by a POTS patient. It's free of use in both Android and Apple. And in this device, you can set a threshold for heart rate, such that if you cross that certain heart rate, then the device beeps and cues you to change your position. So most patients often know what heart ranges, they get symptomatic at. So this can be a good way to keep a track on that and frequently change your position. The Weltery app is another one for heart rate variability, as well as setting the heart rate threshold. Visible is an app that you can use for activity tracking and for fatigue management. This is not specific to POTS. This is for anyone with a chronic condition. However, this is a bit of a hit or miss. Some patients like it, some patients don't. You can give it a try and see how it works for you. Another device that I am very excited about is this device called STAT. And I learned about this at the Dysautonomia conference. This is an in-ear wearable device which measures the blood perfusion to the brain. So it measures how the blood perfusion changes through the day, as well as from lying to sitting. I would like to say that this is not Health Canada approved at present. They have just launched it and are in the process of getting it approved in Canada. However, I think this can be a really helpful tool in monitoring how exercise or rehab is helping in the long run. So I did want to talk about that today. Another thing I'd like to mention is that POTS is very frequently associated with other conditions. It actually very rarely occurs on its own. I've often seen comorbidities like Ehlers-Danlos syndrome, mast cell activation, vestibular migraines, or even chronic pain. And it is very important to work with a provider who's screening for all of these, because this needs to be adapted and accommodated in your program. For example, if someone has POTS and Ehlers-Danlos syndrome, I would have to ensure that the exercises are safe on the joints. If someone has vestibular migraines, then there are some lifestyle factors that can help. Often with mast cell activation, exercise is a trigger. So it's really important to screen and see how the rehab approach needs to be changed with these conditions. So please work with an informed therapist who is able to do that. I added a slide on POTS and chronic fatigue syndrome or post-exertional malaise because I thought it would be valuable for this group. As I said before, graded exercise therapy is not indicated in this subset. It can in fact be very harmful. So exercise is not the place to start. Usually my approach for these patients is to focus on the other areas of management, like fatigue management, compression, fluid and salt, different accommodations and adaptations that we can use to make this tolerable. I find education is very valuable for this subset. And if I do decide to add some exercises, it'll be very gentle bed exercises or very gentle stretches, introduced very slowly, just 1 or 2 exercises. And again, this is not for everyone. Working with a physiotherapist who's informed about ME is extremely important, because unfortunately, the medical community lacks awareness about this. I've often had patients come to me after being pushed into aggressive aerobic protocols, and as expected, it has led to setbacks. So please talk to your provider before starting a program with them. Now, I've just sort of given a summary of some key do's and don'ts when it comes to living with POTS. Some of the things that can be helpful are fluid and electrolytes, compression garments, avoiding triggers such as heat, stress, and large meals. Breaking down meals, like small meals through the day, can be really helpful with POTS. Counter pressure maneuvers through the day can be really helpful. And when you're going from a lying to a standing position, it should be done very slowly. Participating in an individualized movement program can be helpful, and taking rest breaks through the day, performing your grounding strategies through the day can be helpful as well. We want to avoid prolonged static positioning. So prolonged standing, prolonged sitting, any one position for a long duration is not helpful in POTS because we want to keep the circulation going. And pushing hard in exercise is not the way to go. Always remember that happy turtle that I showed earlier. So my closing thoughts would be that POTS is a complex chronic condition. It presents with a lot of symptoms that can affect functionality. So treatment really needs to be individualized and focused on the challenges that you are having. Do we have a cure for POTS? No. But can you thrive and live a fulfilling life with it? Yes. When I went to the Dysautonomia conference, I was so inspired with patients who've been living with this condition for 5 years, 10 years, and are still able to live a fulfilling life with it. Working with informed providers can be helpful, and rehabilitation needs to be towards goals that are meaningful to you. I always say you are the driver of your rehabilitation. You should be in the driving seat of the car because it has to be something meaningful to you. Now, before I end my presentation, I'd like to talk a little bit about the Dysautonomia program that we offer at CPRI. This is a rehabilitation program that I curated because I really saw a need for this in the community. I saw that individuals living with these conditions don't have support or resources, and thus we started this program. It's a very holistic program addressing a lot of the things that we discussed today and more, very individualized to what the person needs. I frequently track outcomes throughout the rehab journey to see if we're making progress. I also offer a group POTS class. However, I only let people join the class after they've worked with me one-on-one. The reason being because I have to teach them to listen to their bodies. I have to screen for all the other important medical conditions, as well as I have to know how they respond to exercise. So that is a possibility after some one-on-one work. I would say the best ingredient in our recipe is that we try our best to listen to our patients, hear what their challenges are and what they need, and try to design a program for that. I will now open the floor for questions, but before I go into that, I did want to say that I do not like to call myself an expert of anything. I have worked with this population, but I continue to learn and will be a lifelong learner. And I'm really grateful for patients who've given me the opportunity to learn with them. Thank you so much for joining me today, and I hope you found this helpful. Should we now go into the Q&A part?
Yep. If you pull up Q&A on the bottom,
yes,
you'll be able to read the questions.
Yes. You're an excellent presenter. Thank you so much. I really appreciate that. My wife and I are caring for a 35-year son with very severe ME or CFS who has been bedridden now for over 3 months. He suffers from POTS and severe PEM. Can you say a bit more about physiotherapy looks like for such a patient? That's a really good question. And as I mentioned in my presentation, with severe ME, exercise is not the way to go at all. It can be really debilitating. It can cause setbacks. What you could try is fluid and salt. You could try, using adaptive equipments. Compression could be an option, but again, the donning and doffing can be very challenging with severe ME. So unfortunately, I would say that from a PT perspective, there is not a lot that we can do for severe ME. But some of the lifestyle factors that I spoke about, especially with nervous system regulation, may be helpful. Ways to deal with sudden reactions of hot flushing and sweating. That's a great question. Now, ways to deal with that would be to change your position for sure. So going into a recumbent position or sitting with legs propped up can be helpful. And this is also why having those cooling equipments with you can be helpful. So cooling towels, cooling fans, ways to cool your body when you're in that state can be helpful. And also performing some of the grounding strategies in a recumbent position when you're experiencing this is a good idea. I hope you find that helpful. Let me know if you have more questions about that. I live in Vernon, and I'm wondering if there's a way of finding out if there's a PT here who specializes in dysautonomia. At present, unfortunately, I don't know of any other PT who worked with dysautonomia patients or that is of another program out there, but we do work with patients virtually. I'm happy to support virtually if that is something that you're looking for. But a good place to check out is the Dysautonomia support group. So there is a Dysautonomia BC support group, and I believe they have a list of all forms of dysautonomia providers in the province. So that may be a good one to look at. So you would recommend utilizing HRV for pacing over heart rate monitoring for pacing. So HRV and heart rate monitoring are different. HRV is actually a tool for the nervous system state. So are you in a sympathetic state, parasympathetic state? And that can be a really good guideline when you're performing a mindfulness or breathwork activity. And yeah, I would say that there are apps that give you the whole day's data for HRV. And if you're in a very low HRV, that means you've done too much that day. So you can even use that for pacing. I like HRV really. I like HRV a lot for tracking with dysautonomia. Do you deal with hyperadrogenic POTS? Some of your suggestions are not good for HPP or irregular or high heart rate. I agree with that. Hyperadrogenic POTS has some different approaches to management, especially with the fluid, salt, and other recommendations like that. We have to curate it specifically for HRV. And as I said, this is why we have to work in a more customized way for these subtypes of POTS. Have you noticed from some of your patients where symptoms worsen based on weather condition? Definitely, summers are very challenging for patients with POTS because heat is a trigger. So using some of the cooling stuff that I mentioned would be really helpful. How can I find a list of providers who are able and knowledgeable in these conditions? As I said, there is a Facebook group by Dysautonomia International specifically for BC. They do have a list of providers that work with dysautonomia clients out there. And I would also say that before you start sessions, have a conversation with the provider and see where their knowledge is at about all of these conditions, how much they know before starting your care with them. For brain fog, you mentioned avoiding triggers such as heat. Could you be specific with heat? You mean under the sun or feeling hot? And why heat can be a trigger for cognition or brain fog? So the reason why brain fog happens is because there is reduced perfusion to our brain with POTS. Now, the reason heat is so heat basically puts our system more into that fight or flight or sympathetic state, which further reduces the perfusion of the brain. So all symptoms of POTS get worse with heat, which is why in general, finding ways to cool your body can be extremely helpful. And then they overall reduce the umbrella of symptoms that come with POTS. What usually causes POTS? There are many reasons for this. Genetic is one. Long COVID has been one of the reasons why a lot of patients have got POTS post-long COVID, so viral infections. And largely, this is a very under-researched area, so we don't have a lot of answers, but genetics, post-viral POTS are usually some of the reasons that I'm aware of. Please send Dr. Rick the WHO salt intake link. I couldn't find it. I am actually happy to put a handout together with all the resources that I mentioned today, and I'd be happy to pass it on to Dr. Arsenault, and then he can forward it further. Would using a cane help if feeling dizzy when in the grocery store? Yes, any form of proprioceptive input, or like even using a grocery cart, using a cane can be helpful for dizziness with the stores, because that helps our brain know better where we are in space and reduces some of that overwhelm. Cooling packs really help me, and a pillow under my knees. Does drinking raise blood volume? If you, by drinking, do you mean drinking alcohol? If you mean drinking alcohol, then actually it is recommended to limit alcohol with POTS, because that can be very dehydrating. I hope I understood your question right. If I didn't, please feel free to clarify. Your slides are different than the ones I received prior to the webinar. Can I get a copy of the slides for the first part of the webinar about POTS? I'm happy to pass on the slides that I used now to Dr. Arsenault, and then he can further forward it. Where can you buy compression garments? Lots of options. Segaveris is a really good brand. Amazon has abdominal binders, and Amazon in general has a lot of the other brands as well. So I would look at brand-specific websites or Amazon. Link of the website with the various types of exercise or CHOP protocol. Yes, I will do this. I will put in a document which has all the resources and links that I mentioned today, and then hopefully you could get some benefit from that. How do I ask my family doctor for working with someone like you, such as keeping track of exercises and taking salt, etc.? Currently, I have a fibro diagnosis. I also have a cardiologist who is dismissive of my heart symptoms you described. Firstly, I am really sorry that you're having this experience. It is unfortunate, the medical gaslighting that continues to happen for people with chronic conditions. So our program is actually a private program, because physiotherapy is not covered under MSP at present. Unfortunately, you can avail our program or our services if you have any benefits, or you're in a situation where you're able to afford private care. Having said that, you have my email on the website. I am happy to support in any way. So please email me and I will do my best to support you. And again, I'm sorry that you're having that experience. Does light rowing machine count as a recumbent exercise? Yes, it does, because anything in which you're not standing counts as a, like you're still in a recumbent positions with your leg flat out, and the leg movement with the rowing, yeah, it does count as a recumbent exercise. POTS symptoms tend to occur at night, worse in the morning. Any idea why? So at least in my practice, I've actually seen mornings to be more challenging for individuals with POTS, because the blood volume tends to get low through the night. Now, if you are experiencing more symptoms at night, then fatigue management may be worth looking into. Often it happens that, we're doing a lot in the day, which takes away our energy reserve. And then the symptoms get worse at night because we've gone outside of our energy envelope. So fatigue management may be worth looking at if your symptoms are getting worse at night. When you elevate your bed, does it also hurt your back if you have back problems? So in this, you're actually elevating your full body instead of just your upper body. So I haven't had anyone complain of back pain, but if back is a challenge, then trying that wedge pillow that I mentioned in my presentation may also be helpful. And again, if it is if it is something very challenging, then it may not be the right approach for you. Also, functional neurological disorders, you may be losing your audience. Please slow down your speech. I'm sorry if my speech was too fast. I really apologize for that. I believe you would have the recording of this presentation, so hopefully you're able to look at it again. And functional neurological disorder is a different neurological condition. And that's just another rehab program that I support. So it's not related to dysautonomia. Fair to say 2 teaspoons of salt per 2 liters. Yeah, 2 to 3 liters is usually what I would say. Will Trineta share her slide deck? Yes, I will be passing on my slides to Dr. Arsenault. And the last question, I believe, is I notice my symptoms worsen when barometric pressure drops. I assume that is lower oxygen availability. Any solutions for this? I'm actually not sure about this question. I don't know what you mean by barometric pressure. Do you mean your blood pressure drops? If your blood pressure drops, then that is something to be evaluated by your provider. I'm not sure about how to answer that.
I think barometric pressure means change in the weather. And so, yes,
Okay.
a lot of patients have that, but it's not related to oxygen because for your oxygen stays 100% is saturation even when the barometric pressure changes. And even when you are in an airplane and the pressure is only 70% of sea level, unless you have lung disease, your saturation remains unchanged.
Yes. Yeah, I do see a few questions here. I'm going to try and address that. I don't have POTS, but I do have some autonomic postural intolerance without hypertension, dizziness when standing quickly or going from bending over to standing up, picking up something, temperature dysregulation, myofascial pain. I'm having treatment from a physio for the myofascial pain and subluxations, and I wanted to start rebuilding some strength. Big exercise. I think for that question, it would be hard to answer that in this presentation because I do think a more thorough evaluation is needed here on what is happening. Is this vestibular dizziness? Is this related to orthostatic changes? What is contributing to the symptoms is really important to dive into here. So unfortunately, that's a hard one to answer in a more generic setting. I would appreciate if you could add subtitles, even if turn on the automatic ones. Thanks in advance. I will definitely keep that in mind for future presentations. Thank you. Do you have recommendations on increasing weight, like from 2 to 5 pounds while not exacerbating symptoms? Again, that is hard to answer in a generic format. I would need to evaluate you more personally to be able to help with that. I'm just making sure I don't miss anything. So helpful, thank you so much. Can non-professionals and paraprofessionals attend POTS conferences? Also, thank you for sharing this through presentation. Yes, the Dysautonomia conference actually can be attended by POTS patients as well. It's a really great platform to connect with other people going through the same experience as you and learning. So it happens every year. Do keep a tab on their website. It's a great resource. Is low B12 associated with POTS as well as low sodium? I actually do not. I'm not very well aware about the nutritional aspect of things because that's not in my scope. If that is a concern, it might be worth discussing with a nutritionist or a naturopath.
B12 deficiency not associated with POTS.
Okay, thank you, Dr. Arsenault. Thank you. What a great presentation. Makes me feel hopeful. I'm really happy to hear that. Thank you. Very knowledgeable and informative. Thank you. I have a POTS diagnosis from my primary care provider, but have not seen any specialists yet to individualize a treatment plan. There are other comorbidities under investigation. Would physiotherapy be good for me while I am waiting to see specialists? It can definitely be something to consider, especially if the physiotherapist is informed about these conditions. Please make sure that they screen for ME/CFS or at least post-exertional malaise symptoms. And some lifestyle factors like nervous system regulation can be started irrespective to manage some of the symptoms that you're experiencing. Does the POTS test in the AM when I wake up, my heart is already racing? Doing the POTS test. Yeah, so actually, this is a very good point that you raised, that the timing of doing the test can be, something that is important when you're having POTS symptoms. So if you're getting tested for this, this might be something worth discussing with the provider who's testing for it. I've been living with POTS for 50 plus years. My symptoms have worsened over the years, especially since I have severe ME. What recommendations would you have for bedridden patients? Thank you for your informative webinar. Again, as I said, with severe ME, there is not much we can do from a rehab lens because any kind of physical activity can be a trigger. But I would say think about the sensory sensitivities, think about adaptive tools that you can use, think about nervous system regulation. If compression is possible, if you have someone at home to support you, then those are some areas that you can dive in to. But exercise would definitely not be recommended here. Are you familiar with and or recommend the Q collar for POTS? This is a concussion prevention device that puts gentle pressure on the carotid artery to increase blood perfusion in the brain. I'm actually not familiar with this. Thank you for pointing this out to me. I will definitely dive deeper into this after the webinar. I am wondering if POTS is the reason I gain energy after cardio. I always feel energized while friends get tired. Also curious if you have tips specific to concurrent Raynaud's and POTS. So gaining energy post the exercise long-term helps POTS, but immediately actually most patients have some fatigue. But it could be that you've been exercising for a while, and which is why your body is responding well to it. So I don't know your exact situation. When it comes to Raynaud's, cooling, especially with the cooling devices that you're using, you want to be mindful that you're doing just enough to maintain your temperature, but not cooling to the point of triggering your Raynaud's symptoms. So we just have to find the right balance in regards to those two. Great presentation, thank you. I make an electrolyte solution for daily use, but I'm worried about too much salt. My family history includes heart disease. Can I avoid sodium and still benefit? This is something that you should discuss with your provider, and which is why I don't make fluid and salt recommendations, because it is only the medical provider who can gauge all these factors and give you the right recommendation. Is it POTS if some days my heart rate goes up 30 beats per minute on standing in the morning and other days not? And I have post-COVID syndrome. Are the POTS symptoms in long COVID curable? Do they resolve once recovered? So one of the things in the POTS diagnostic criteria is to exclude other conditions that may be causing the increase in heart rate. So which is why, again, the diagnosis is something that has to come from a specialist. In terms of recovery, to the best of my knowledge, POTS doesn't have a cure, but POTS can go into remission or become very manageable. So that is to the best of my knowledge.
So the question about POTS, remember POTS is a syndrome. And the problem with a syndrome is you're either in or you're out. So let's say you have POTS in the morning. Does that mean you go into remission in the afternoon? No, it just means you have a milder version. So some patients will only fulfill criteria for POTS when they're in post-exertional malaise. Other patients will fulfill it just in the summertime. Other patients, so it doesn't mean that you kind of go in and out of a diagnosis of POTS. That's just a reflection of how it is to work with syndrome-based diagnoses, when the reality is everything exists along a spectrum as opposed to yes or no. So yes, you do have POTS, but you have a milder version that isn't there 24 hours a day, which is also why often when we start treating for medication, because the symptoms are worse in the morning, we often start with a short-acting beta blocker because some people don't need treatment all day. And so, yes, you do, if you have a 30 beat or more within 10 minutes, you fulfill criteria. and you just have a milder version that isn't there 24 hours a day.
Thank you so much. That helped me learn as well. You're a very clear speaker. Thank you so much. I really appreciate it. 29 years old, assigned female at birth, and recall having these symptoms for up to 7 years and diagnosed for fibro for 2 months. Is there any more tips for people in my age group and demographic? I'm not exactly sure what you mean. Tips, I'm not really sure. Do you mean fibromyalgia and POTS, or do you mean just tips for getting diagnosed early? Usually I do have a lot of young teens and pediatric POTS patients that I work with, and I use a very similar approach. And when fibro is the case, then chronic pain management is again something to account for. Doing the POTS test in the AM, when I wake up, my heart rate is already racing. The test shows only 20 points spread difference, max after 1, 3, 5, 10 minutes. So yeah, that doesn't unfortunately meet the criteria for POTS because the criteria currently is 30 beats per minute. Your heat suggestions, are they relevant for menopausal hot flashes too? Yeah, of course, you can definitely use them for any kind of hot flashes. There are just some easy ways to keep the body temperature regulated. How do we know what a good HRV level is? I only start tracking this after I become symptomatic, so I don't know what my healthy baseline would be. So yeah, there are some, so when you wear the HRV wearing a real-time HRV monitoring device can be quite helpful because we can set thresholds on that. And then when you're reaching the lower end of this threshold, it starts beeping or it gives you a little vibration. And then that can help you do some activities that bring your HRV up. So having your own HRV monitoring device real-time is actually a really good adjunct. Do you have any recommendations for patients with POTS symptoms caused by neck instability? To the best of my knowledge, POTS is not caused by neck instability. I'm not sure if you'd like to add on to that, Dr. Arsenault, but to the best of my knowledge, it's not caused by neck instability.
It's associated with neck instability, and that patients with hypermobile disorder are more likely to have it. Yeah. And it's also associated with craniocervical instability or atlantoaxial instability, but not causal. Having said that, when compression of the neck can make the symptoms worse.
Yep. Does passive exercise work for ME patients? Passive exercises like stretches with someone else helping you through can help with some muscle tightnesses or some pain that may be associated, especially with prolonged positioning in like prolonged recumbency. So that can be helpful to maintain, to help with some of the pain management that comes in. Does this mean after doing the test twice with same results, this isn't a POTS situation? I would say this requires more evaluation with your specialist if it's not reaching that 30 beats per minute. And again, some symptoms can be associated with post-exertional malaise, so that is a conversation to have with your specialist. Can you say more about how HRV relates to POTS? Yes, so heart rate variability, again, a really good indicator for the fight or flight dive or the parasympathetic drive, and lower HRVs mean more sympathetic state, higher HRV means more parasympathetic or rest and digest state. And wherever we start, we want to go towards increasing that HRV using some of the regulation strategies. Drinking. Thank you, great information. Would you recommend cooling blankets? Yeah, cooling blankets is another good one, especially in summers. People like it quite a bit. So definitely can look into that. Is the POTS test accurate and or worth doing? I think it's a good measure of screening and understanding how the vitals are changing with the position. To the best of my knowledge, it's a good screening tool. Thank you so much for this thorough and knowledgeable presentation, and thank you for emphasizing different guidelines for those with ME/CFS. Thank you. Regarding the previous question about the cane, my GP would not give me a prescription for this previously, as he said it was not indicated. And this was only useful for people with one-sided injuries. I would like that he misunderstands my condition. Would you have any literature or publication? Okay, so there is no literature for cane for people with dysautonomia or POTS, or dysautonomia or POTS. If I remember, your question was about the grocery store. Now, the way to think of this is that adding some kind of weighting or equipment helps our nervous system feel more oriented about the space that they're in, and that can help some of that dizziness with visually stimulating environments be combated. Now, if you do work with a vestibular PT or someone who understands this, then they can probably explain this to your doctor. But there are research papers that talk about proprioceptive input helping with navigating these challenges. And I can add a paper for that if you like in the resources that I send out. But if grocery stores is a challenge, then I think even a grocery cart can be really helpful if that's something you'd like to add on. Do you have a long wait list to see you? Are there more specialized physios at your clinic? I have about a 3-week wait list at present, so it's not too bad. And if someone really needs help, then I do stay extra hours or come in early and try to accommodate them. So we do our best. At present, there is no other physio, but I am working towards mentoring more physios. Do you have any information about the seeming link between POTS and COVID? Why this might be such a common part of long COVID? Yeah, there are a lot of articles that are actually now talking about POTS and long COVID, and I'm happy to attach some information on that in the resources too. You didn't lose me as an audience. You're doing great. Thank you so much. Are you working out of both New West and Vancouver? Yes, I'm working at both locations. I have more availability at New West, but I'm trying to add more time at Vancouver as well. Thank you. I think I answered this question. Can you talk about vestibular migraines? So yes, vestibular migraines are migraines which are related to our vestibular system. So this is when our vestibular system becomes very sensitive and it causes an array of symptoms like dizziness, vertigo, constantly feeling floaty or nauseous. Now, an important thing to understand is that this is not a vestibular system disorder. It's more of a nervous system disorder. So it's your nervous system and vestibular system together becoming very sensitive, and a processing issue is happening there. Now, the thing with vestibular migraines is that they often come without headaches, which is why sometimes the migraine aspect is missed or not looked at. But a lot of lifestyle factors can help with vestibular migraines, like supplements, seeds for migraine, and some medications. So if you work with a provider who understands this, then if I have a patient where I'm suspecting vestibular migraines, I usually send in a note to the doctor to consider medications that can be helpful. But one thing to know is that they may not always come with headaches. I mean, is it possible to build strength? Yes, within your energy envelope, we can definitely some strength-based exercises can be worked on. Are your services covered by private health? Yes, our services are covered by private health. Okay. Weight or minor strength training question. Is this something patients can see you virtually, or does it need to be in person? We can do it virtually. We can use a lot of tools in the house for strength training. Water bottles, bean cans, there's a lot of things around the house that can be used. So just about getting creative. Is the ongoing tachycardia bad for my heart? I didn't tolerate beta blockers well. Unfortunately, not in my scope to answer that. I would leave that to discuss with your specialist, or maybe Dr. Arsenault can highlight more on that. Just wanted to express my gratitude.
The short answer is yes. And so having a heart rate that's in the tachycardic range all the time is bad for your heart.
Thank you. Thank you so much for all your kind words. It means so much to me. So are the POTS-related symptoms post-COVID curable, or can they recover fully? As I said, to the best of my knowledge, we don't have a cure for POTS, but it can go into remission and become more tolerable with the right strategies. I have an upright stationary bike. Do you have any recommendations on how to use it in replacement of a recumbent bike? Upright can be challenging in the beginning and always not the best place to start. I would think of it in a way that our brain is getting less blood, there's less perfusion, which can be detrimental if we couple exercise with that. So other ways to get creative, as I said, are the air cycling, interval training, or just lying down and practicing some stepping on a platform and doing that in an interval training format can be better places to start. I have all the symptoms, but no primary provider or diagnosis. What should I do? I have fibro, severe ME, plus other central sensitivity. I am desperate for a provider and help. Again, as I said, look at the BC Dysautonomia Facebook group. They have a lot of resources on providers who are informed in these areas and that you may get some support from. Do the techniques you have spoken about also work for neurally mediated hypotension? Some of the techniques like the nervous system regulation may work, but with regards to compression, lifestyle, etc., I think I need to understand your medical history more before being able to answer that. I have dysautonomia and high blood pressure, but also dizziness and nausea if I move too fast. If not POTS, is this a syndrome? My heart rate can accelerate fast when talking. Again, hard for me to answer that here because I do need to dive in further into what's happening. There could be various contributors to these symptoms, and I really would have to understand your medical history more. If I wanted to try and claim the bed wedge to insurance, what phrasing would you suggest for condition or management? You could always just frame it as, bed elevation has been recommended for some of my morning symptoms associated with POTS. There is research for bed elevation as well. So maybe just using, explaining it in that way on how it can support you may help you get insurance coverage for it. I don't fulfill criteria from at-home test. I do have a diagnosis of neurally mediated hypertension. I do have BAM. Would I benefit from working with a PT? Thank you. With post-exertional malaise, again, as I said, exercise has to be very carefully monitored or prescribed. So working with a PT can be helpful in understanding can be helpful in getting in some of the other lifestyle factors before exercise. My iWatch measures HRV. Do I need some more sophisticated, or is it advocate for giving an idea of HRV trends? To the best of my knowledge, the iWatch only gives you a trend of the HRV, but not real time. The reason I like real time HRV is because I can incorporate that with a breathing or mindfulness activity. Excellent presentation. Walking poles and Nordic poles are good for walking. Yep, walking poles and Nordic poles are actually excellent for proprioception, and I use this a lot in my practice. What are the symptoms of vestibular migraines other than headache? Headache is actually often not seen in vestibular migraines, and some of the common symptoms are this constant floaty feeling like you're walking on marshmallows, nausea, there can be vertigo, not be vertigo, a lot of fatigue. So those are some of the symptoms, and light sensitivity, noise sensitivity, because the nervous system is in that overdrive. Is vestibular migraine same or different than 3PD vertigo? They're actually not the same. Vestibular migraine and 3PD are different and often need different approaches to care. Thank you for your talk. Can you do the physio without triggering mast cells? It is possible. However, we would have to see your response to exercise, which is why done very slowly and usually when the muscles are in control with medication. Is there a watch that keeps track of heart rate in real time and signals when we can go out of our ideal zone? As I said, the Tachymon app is actually really good. Apple Watch, Fitbit are also great adjuncts, but the Tachymon app is really good for this. I think I've covered all questions. I hope I'm not missing something.
Thank you very much. I have learned a ton of new things today. And
Thank
I'm
you
sure
so much.
had a very good turnout. So thank you. And hopefully we will have Trineta back to talk about another topic. Take care, everybody.
Thank you so much for having me. Bye-bye.